Dear colleagues, dear friends, it's my great pleasure to chair this session, this specific special lecture delivered by Professor Roberto Volpe from Rome, a good friend of Greece. And the topic is also focused on the alliation, Italy and Greek aligned in Europe for the cardiovascular prevention. We have new guidelines on cardiovascular prevention, but also the Hellenic Foundation for Cardiac Prevention is actively working in this area. And we're looking forward, Roberto, to hear your talk. Thank you for being with us.
Scariso to you for a kind invitation. It's always a pleasure to join Greece. And I go with my okay, so that our collaboration starts from a long time, is more than 10 years, when I've been invited by Dimitri Richter in Athens. He invited first Professor Catapano, that in that period was the president of European atherosclerosis. So he couldn't come, and he phoned me, Alberico phoned me, can you go to Greece? Oh, sure that I can go. It's always a pleasure. Also because I am one of the Roman that follow Horatius. Horatius, the famous Latin poet, he wrote that Rome conquered Athens, Greece, but the Greek conquered the Romans. And my father, me, my daughters, we studied classic Lyceum and Old Greek language. Unfortunately, not the new language, but Old Greek. And so we started to collaborate with Dimitri, and also with ΕΛ.Ι.ΚΑΡ Foundation, with the Italian Society for Cardiovascular Prevention inside the European Heart Network. And I like to give my tribute to Professor Tututzas, that unfortunately he died recently, and he has been inside the European Heart Network. He organized two annual meetings in Greece in 98, 2008, and so has been a great professor, not just in Greece but also in Europe and inside the European Heart Network. And the European Heart Network has a characteristic that there are doctors, but there are also sociologists, managers, and above all in Northern Europe. So it's nice when we can collaborate between society, between federation as a doctor, because we have a common view. And for example, with the ΕΛ.Ι.ΚΑΡ Foundation, we spoke in Europe about familial hypercholesterolemia, because we know that is under diagnosis and undertreated, and our goal has been to spread, for example, in Europe, the Dutch lipid score, that is something that we believe so much in this score to have a good diagnosis of familial hypercholesterolemia. At the same time, we work on improve the LDL target, improve the patients in secondary prevention, but also in primary prevention. This is for secondary prevention, that to reach the LDL goal that is must be below 70 milligram DL, also more lower. Now we speak about 55. You can see that Italy and Greece, we as other countries, we are not so well. Many of our patients still have LDL cholesterol above the guidelines. So for this, with the Greece Art Society and Federation, Hellenic Federation of Art, we joined this webinar 2 years ago with Georg Dikopoulos, and which chairman was Dimitri, and in Paris. And that was one of the last meeting that we did in presence, and we spoke about the target of LDL. So this we brought in Europe, starting from Italy and from Greece, because we underlined that it's not a problem of lack of efficacy of low tolerance of the lipid lowering drugs, but it could be a problem of diagnosis, of access to optimal therapy, to low adherence, and sure that we have to do a mea culpa, because also the physician, we have to be very careful about this, the target, about the adherence. And but we are in a European Art Network, we work also on the lifestyles, and when we work on lifestyle, sure that we have to remember the father of medicine, Hippocrates, and that he understood everything 2,500 years ago. He didn't speak about smoke, because smoking we imported with Columbus during the American trips, but we can speak about Mediterranean diet, about physical activity. And when I go to speak in the high school, if I speak I go to speak in a classic high school, I can speak about Mirone or about Orsipo, but sure that in other school that they don't study all Greek literature and art, I speak about the new hero that we have in Rome, Traiano Dellas and Costas Manolas, that played with my team AS Rome. And we consider hero above all Manolas, and you know maybe why, for the third goal to Barcelona. And anyway, when we speak about diet, it's important to underline that the dietary risk is a cardiovascular risk factor, very important. Sure that we can imagine, because if we consider that bad food habits are the cause of hypertension, hypercholesterolemia, diabetes, obesity. But it's important to know that also dietary risk is a risk for cancer, and nutrition obesity can be cause of the 1/3 of cancer. And we always think that is a diet high in salt, high in saturated fats and trans fatty acids, but we can see that often is also a diet low in something, low in the food typical of a Mediterranean diet. And in Europe, we are speaking above all about whole grain products, because we know that just 50 grams of whole grains can reduce the cardiovascular risk more than 20%, but can reduce also cancer mortality around 10%, total mortality. And it's a pity, because just 3 portions of whole grains we can reach the 50 grams, and a slice of bread is 1 slice of bread is 1 portion. 80 grams of pasta, 80 is 1 portion. So of rice, so it's not very difficult. And we have to see the Greece, because the Greece is one of the few countries, as Scandinavian countries, and now also Germany, Holland, but Greece reached the target. Unfortunately, in Italy, we are too far, and so it's important to change our experience between countries, but also inside the European Art Network, to spread the culture of whole grains, to to improve the cardiovascular prevention. And we can see the data in Italian also for the children. By the way, children, unfortunately, this is our Achilles heel, because Italy and Greece, we have unfortunately high rate of childhood obesity, and it's something that is increasing year by year. And for this is something that we cannot tolerate. It could be what Bill Clinton wrote in a cover in the introduction of this book, that he wrote that for the new generation, maybe they could live less than their parents. And this is something that we cannot tolerate. Above all, we, the Italian and Greece, that we put our signature on the San Valentine Declaration of 21. Every child born in new millennium has the right to live without cardiovascular disease, at least 65 years old. But the situation, unfortunately, is not so. And so, again, we have to start from Greece, from old Greece. Aristotle, another that understood everything. When he spoken on Megas Alexandros, Alexander the Great, he spoke that the education of young people is so important. And I have to thank the ΕΛ.Ι.ΚΑΡ Foundation, because give me the support to work on a project that we are doing now with the Lithuanian high school, Italian-Lithuanian high school, as a vending machine for a friend, the translation of Italian name and Lithuanian name, that vending machine can be a way to improve the healthy dietary habits in the school. And we saw that we need the Greek children, Italian children, we need to change something starting from the school. And physical activity. We know that sedentary life is a risk factor, but we know also how many advantages we can reach with the right physical activity. And in this, again, we have a collaboration starting from a project of a European Commission that about, the name is Women Ardors, because we know that often the women have less physical activity versus male. You can see here that there is a ΕΛ.Ι.ΚΑΡ Foundation, Italian Society for Cardiovascular Prevention, and in this for this project we cooperate with Georgios Goumas, and we need, we spoke about the physical activity. These data are not recent, but show that how Italian boys and girls and Greek boys and girls, they don't do good physical activity level. They don't reach a good physical activity level in compared to other European countries. And also in childhood, there is a difference between a male and a female. So for this, our project want to check the reason for sport interruption, and there are so many. We can see that, for example, in Greece, it's so important, the study. And but we want to see also the reasons to resume a physical activity, because we must be optimistic and we want to try to change these habits. And so here, I don't want to speak about this now, but we are working to also at political level to improve the physical activity for women. And another Achilles heel for us, for Italian and for Greece, we smoke too much, unfortunately. And also not just the adults, but also the in childhood. You can see that, for example, Italian teenager, they have a gold medal for for smoking. They are the #1, unfortunately, in Europe. And Greece is a little bit better, but also for the male, for the boys, the situation is not so good. And for this, we have to work if we want to reach this tobacco-free generation. We have many years, but we have to work on this field, because we start in a bad position, and we can work also in the sure that the best choice is quit smoking. But if the people cannot quit, is important also alternative to cigarette, for example, e-cigarette, or also the heated tobacco products. We can see the data from UK or from Japan, how there can be a reduction of e-cigarette. For this, we called in Italy just less than 2 months ago, Dimitri Richter to have a lecture about what we can do it in Europe, the rules to improve the situation in Europe. So we believe so much in cardiovascular prevention. This is the book of Christian Barnard. We know that he gave fantastic work for heart transplant, but unfortunately for arthritis, you have to change to work on cardiovascular prevention. And he wrote something of interesting for us, that he could save 150 million of life working on cardiovascular prevention. So for this is important, our alliance in Europe. And again, something that comes from all Greece, Democritus, that is so interesting when he wrote that, okay, we ask help to our gods, but the destiny is in our hands. And so we, with the lifestyle and also surgical therapy, we can reach a very important goal to longevity, but in good health. And this is possible also because we have to defend the record. You can see that Greece and Italy, that we have a good life expectancy. Unfortunately, this is 2019 and 2020, we lost, above all in Italy, we lost 1 year because of COVID. But it's interesting to know, my last slide, that we reach this good level of life expectancy with few money. And compared to other countries, we spend few for our health, but we reach a very good level of life expectancy. Sure that we have to improve the cardiovascular prevention, also the cancer prevention, and for this I'm so glad to co-work with your Hellenic Federation in Europe. Efkaristo for your attention.
Thank you so much, Professor Volpe, for this excellent talk. Thank you for your great contribution in the cardiovascular prevention in the field, in this specific field. And also thank you so much for contributing in the nice cooperation between Italy and Greece. Many, many thanks. And just one question, because the time is over. Do you think that now, as we, let's say, enjoy the transition of the medicine from the state of the let's say, medicine up to now was dealing with the treating patients, but now with the artificial intelligence, with this digital transformation, we will use only algorithms for diagnosis and treatment. Do you think that the field of prevention could have any extra benefit from this digital evolution?
Thank you for the question. Very interesting, and I think so that we can improve. We can work on 360 grades on cardiovascular prevention. Every new possibility is welcome.
Thank you so much. hopefully next year to have you in physical presence in Athens. Thank you. Thank you.
Yasu.